and welcome to Perspectives with Lisette and Martina. I should have did like my general this is you, but that's okay. We have plenty of time to do that because this is our show. This is us. So yeah, we are in 2023. We're not really gonna do a catch up right now. That's gonna be like either you have already seen that video by this point, or it's just a brief video just highlighting what we're going to be focusing on in 2023. But really, a little bit of backstory here. Lisette and I have been sitting here for like the last hour.
Yes.
Because we have, we're both planners. I'm a Capricorn and she's a Virgo. So we're planner people and we think ahead. So, we got the year kind of already stretched out, what we want to do. But, we were like, what do we want to talk about first? And so we literally spent an hour going back and forth about two topics, which we will generally talk. I mean, we will get to both, eventually. Yes, and we'll probably have multiple episodes about both topics. But we literally were sitting here and we got so heated. And Lisette's like, shit, let's just go ahead and record. Like, this is like, we've been talking about this for an hour. Let's just go.
Yes, we had to like pause. I had to pause us because we were just going on a roll.
We kept going. So essentially, that's what I think we're gonna keep it with tradition a little bit. We're gonna focus on healthcare. I mean, healthcare is gonna be a theme. I think forever for like perspective,
especially for us.
It is us. That's just what we do. That's what we do with our 9 to 5. That's what we're gonna focus on. But today, listen, I think you explain this better than I do. You go ahead.
All right, so Martina and I have been talking, as she mentioned, for the last hour, really around healthcare, but specifically around obesity. If you're watching this, you do know that Martina and I are bigger women. We have talked about this. We've had dating while fat, being a plus size girl, around fashion, and we even talked about healthcare. Being a plus size woman and sort of our experiences. But recently, unless you've been, not paying attention to the news or even social media, there's been a lot of conversations and a lot of discussion around weight loss medication, and weight loss drugs, and who should be taking it, who shouldn't be taking it. Why, people suddenly, all these fitness gurus out here, suddenly medical professionals saying how it was bad for you and like how people shouldn't be depending on these weight loss drugs. You're just going to gain the weight back if you, once you're done taking it. There's all these conversations. So for me, I'm actually on one of them. And I'm taking it because I have legitimate health concerns and issues that require for me to take it, and we'll get into it. I'm not afraid to talk about it. I'm not embarrassed about it. So we'll get into it. So Martina and I were chatting, and we were like, we need to bring this up because this is part of our conversations, our journeys, and something that impacts us as women, us as women of color who are, fat women and obese and overweight and whatever you want to classify us as.
Whatever they want to define.
Whatever you want to define us as. And there's so many nuances to it, right? So there's the health reasons, there's the health benefits to these medications, and there's the conversation about prevention versus waiting until you have a disease to do something about it. And then there's a conversation about just the healthcare system and health insurance and the role that insurance plays into access to medication that will actually help you prevent diseases, and the role that plays. And we went down a rabbit hole of just the history of insurance in America, like healthcare insurance in America. And that's where we got heated. We were reading certain things And if you just change certain words, it's as if they were describing our modern day healthcare insurance and healthcare system issues. And I was getting heated because I was like, I can't believe since like the early 1900s, we'd be having the same issues and the same problems with health insurance.
Cussed. She cussed. She never cussed unless she real heated. She's, boy.
It's just so that's what we're gonna talk about today. Probably gonna be multiple episodes because it's not a one and done conversation. But it's really been interesting to see it play out, particularly in social media, right? Because social media, you get a spectrum of, you get your healthcare professionals that have platforms, you have actual doctors who work in obesity and like weight management and who are experts and have like science and things to back up why these medications are actually worthwhile and they're good for people and they're helping people become, healthier and better. And then you have healthcare professionals who are out here shaming people for taking this medication. And then you have your fitness gurus who have suddenly, like I mentioned, become experts in healthcare and medicine, and are shaming people who are taking this. And it goes back to the same thing that we've talked about before, Martina, about like, oh, you should just be able to do it, out of willpower and your own willpower and pick yourself up from your own bootstraps and be able to just work hard and lose weight and just, everything, whatever else you do. But then you have whole industry of health products that are supposed to help you lose weight, these medicines, pills, powders, teas,
you name
but
it.
ain't nobody saying anything about that. And people who have been overweight and struggling taking that, they rather you take that and like do all of that, instead of taking a medication that actually helps you, has benefits to you. But like, no, you go and struggle, go take these powders and pills and teas, and do that, and then just go to the gym versus doing this. I was like, again, the way we talked about it was science versus capitalism. We kind of came up with this. That may be the title for these conversations in this series, but it really kind of ties into a lot. But I'm gonna pause. I'm gonna let Martina share her thoughts.
You can tell so
we can get into it.
She's still very heated. But yes, like both of us, we are larger women, and as Lisette mentioned, she's on one of these drugs, and I'm on another one. So we're both on drugs. I hate saying the word drugs. I hope people know.
I know, right?
Medicine. Like, I am anti-drug over here. Okay, so we are on medication. We're both on two different medications for the same issue here, to help like with weight loss. Well, that's just a factor in it, but to help with our medical conditions. And it just happens, weight loss is just one of the things that comes along with these medication.
Right. A side effect.
Yes, it's a side effect because and really, that's how my doctor described it to me. She was like, this will help you, with your medical conditions, and just to, have an added benefit, you'll lose weight. That's one of the side effects of it. And I think, one of the things, that we were talking about earlier is to kind of, in this country, in the United States, we're so about being reactionary with like, not just healthcare. I mean, we talk about police brutality. We talk about, all sort of things on here that just operates that way in this country. And I think it's definitely the same for healthcare, because as you're saying, science versus capitalism, as long as you're sick, that's a business. I mean, as we have said many times before, healthcare unfortunately is a business. And I say that unfortunately and fortunately, because there are people out there who are doing good things and they just happen to be making money for it. Because we live in a world where you have to have money to live. But I think, I'm trying to put this in the frame of mind. What we were saying is that this whole thing about people who are obese, who may not necessarily have any conditions, any medical conditions just yet, it's almost like people are upset about that. It's like, well, why don't you just wait until you get like high cholesterol or wait until you get diabetes? For what? So you can have something to say about that too. The whole point in this country, we should be more preventative. I mean, we don't spend enough time, and I don't think resources talking about preventative care and just prevention overall in this country, again, across many different areas, but especially in healthcare, that should be the number one thing should be prevention. We shouldn't be so reactionary. If there's a way to help people who are struggling, and as we now know, people who are categorized as obese, a lot of that is tied to genetics, just like many other things, just like the color of your hair, the color of your skin. It's genetics. You can't do anything about it. But for some reason, that like people find that so difficult to believe that obesity is genetics. And again, it's, we have a lot of fat shaming, we just have a lot of shaming of people who are bigger. And again, I just think this is just so interesting. But I'm not surprised that this is the way that this country has decided to go with this medicine or with these different medicines. Because again, even if somebody, like I said, they may not have diabetes, they may not have high blood pressure, but they may be obese, they may be larger than they should be. Why is that everybody else's problem? I just don't like, even if they're taking this medicine just to lose weight, that's not your problem. That's not your problem. Because I feel like people continuously insert themselves into people's lives and problems. Honey, we all have enough problems to deal with. Why do you want to insert yourself for a group of people who are trying to be healthier? They're trying to, be medically healthier. And if they just happen to be taking a medicine to help them lose weight, why is that really anybody's business? That's my thing. That's kind of a big thing for me. Like, it's not your business. How is this impacting like a fitness guru or all these, mean people, their comments on social media or just in media in general? Like, what does this have anything to do with anybody else's lives but that person's? Like, that's their own journey.
Yeah,
that's my biggest takeaway right now.
Yeah, I think one of the things is you were just right now talking, like, it's definitely between, like, for me, it's between me and my doctor, right? If my doctor believes that this is going to benefit me, this is going to help me in the long run to prevent me from having heart disease, having strokes, all these things that could happen if I, continue the trajectory that I was, even though I was trying, like, right, like I was trying, I had taken medication, I had, done it. And then when you think about like medication that I was like multiple medications for different kinds of things, it just wasn't doing what it was supposed to do. But to your point of like, this is between that person and whoever their doctor is, and if their doctor believes this is going to help them, then how's it impacting you? Like, sort of the conversation between that I've been hearing on social media a lot, is people taking the medication away from those that medication is meant for, those that are type 2, that have type 2 diabetes. And people are like, oh, you're taking it away from those that really need it. It's a life-saving medication. I don't have access to it because there's shortages, and
Right.
That's a whole other conversation to be had about the shortages and the pharmaceutical companies and capital. Like, there's a lot there to unpack as well. But it's like, but if they're taking it because they're obese, right, and they're taking it because they want to prevent
hear about froze on my end. I just like, I hear part of you. But then okay, now you're back. Like
Okay.
it had froze for a minute. I was like, no, she's saying
Okay.
some stuff. Okay, but I think you're back now. You're back.
Okay. Let's see if it stays that way. But I was saying, like, you know, if they're making that healthcare decision for themselves, right? And they're preventing the disease that you might have, whether it's diabetes, you know, being pre-diabetic, you know, even just thinking about like cholesterol, like high cholesterol, and thinking about high blood pressure, all these things that could lead to much more serious
Yes.
Issues.
Yeah.
It's a healthcare decision that they've made with their doctor, with their physician, and it shouldn't be they shouldn't be shamed for taking a medication that's helping them, that's making, and like the stories that I've seen, you know, whether it's, you know, on social media of, you know, individuals who have been on this medication have said, you know what, I was going down a path where, you know, I was pre this, or I was having this, and I just, you know, I just couldn't lose the weight. Like I did everything and it just wasn't working. You know, people that are binge eaters, you know, and people that understand how hard it is to lose weight, and they're like, this has just helped me be able to make the right choices, right? The right health choices, and be able to eat less, or just be able to do the things that I've been wanting to do but never have been able to. And now I'm, you know, losing the weight, I'm becoming healthier, I'm starting to exercise, I'm, you know, eating, my eating habits have changed, like all these things. I'm like, good for you, yay for you being able to do that, because I'm like, that's the whole point. Like you said, our healthcare systems, our health, the conversation around healthcare never really talk about prevention, right? Like it's more like, oh, I go to the doctor once something is wrong with me. Like
Yeah.
it's not, and that's how our society has built up healthcare. Like it's like, hey, you go, you treat when you have something. And you know, I remember, I think it was like this time, maybe last year, when we had Dr. Mejia talking about healthcare, and I remember him talking about prevention being so important for our communities, particularly our Black and Brown communities, and how important it is. And I was like, if this could help prevent the diseases that are killing our Black and Brown communities, then why can't it be an option for us?
Yes.
You know, and are there people who are taking it to lose like 5-10 pounds, or like 20 pounds? Yeah, you see it, you see the celebrities, and I think people who are taking it for reasons that are just very much like cosmetic, you know, like cosmetic in the sense of like,
Yes.
I'm a celebrity, I have the money, I want to take because I just, you know, it's easy or whatever. That's a whole other conversation. Like that's for us to unpack and dig in. I think there are those. But a lot of people who are taking this medication who are not type 2 diabetic, um, are really taking it because they've struggled with weight either their whole lives. Women who have just struggled it because they have PCOS. And if you don't know what PCOS is, it messes up with a bunch of your hormones. It makes it harder for women to just lose weight in general. You know, you're deregulated, you know, your hormones are like out of whack, all these things. And it makes it really hard to lose weight. You could be doing all of the right things. You could be exercising, you could be eating healthy, you could be on a calorie deficit every day, and that weight just ain't budging, because PCOS tends to be an insulin resistance disease. Like that's what it is. Like a lot of women who have that also know that they're insulin resistance. If you and insulin resistance is sort of like, you know, with diabetes, like your body just is not. So like this medication has helped. I mean, I've seen so many women who have PCOS just say like, once I started taking it, a lot of my PCOS symptoms and everything were just going away. And then I started dropping the pounds and just being able to do what I haven't been able to do. And I'm like, amazing. Yes. Like, why aren't we lifting up more of these stories versus the stories of these, you know, rich and celeb, you know, and famous people who are using it? Because they have the money to pay right out of pocket for it, because this medication is expensive.
Yes.
I mean,
I was waiting for one of us to get into it, because I was like, I don't know if we got time for this today, but the damn
I know we're kind of jumping around, but it's just there's so much to unpack.
There's so much to unpack.
Yeah, but I'm gonna pause.
Well, shit. What did you just say? Because like before I said pharmaceuticals.
I said rich and famous people taking it
price
because they can afford it because of the price. Yes,
the price. Well, you know, for instance, for the medication that you're on, I mean, thank heavens you have insurance, because if not, it's like over $1,000. And this is
it's not even my insurance. It's because the company that makes it has a savings card.
That damn savings card. That's
my insurance don't cover it. We're gonna get into that later.
That damn savings card. And so, because I remember you telling me about some of this when you first started, and the fact, because I think you knew the exact fucking price. You were like, "Oh, I know this is how much it costs." Okay, and with your card,
I can tell you right now.
Wait, and with your card, it's only what, like $25, $15? Yeah, it's like, and the long story short is that, you know, I think to back up a bit, you know, we're talking about this weight loss prevention medicine. There are shortages, and you know, to me, when I hear stuff like shortages, you know, okay, most y'all who watch, y'all know I'm kind of a conspiracy theorist. Now I ain't no crazy conservative Republican, you know, conspiracy theorist, but I can believe in some conspiracy theories. Now, for me, when I hear, okay, there's a shortage in this medication and people who really need it can't have it, first thing I think about is like pharmaceuticals. I'm like, listen, why are you not making enough? Now I get it, the whole supply and demand, but supply and demand also goes back to capitalism as well. So why is this issue of like, there is a shortage happening? Because I feel like, why are you not being able to produce it at the rate that it needs to be? Now, if somebody has some much more educated information around this, I would love to know, because to me, I just think like they're saying shortage, and that's just kind of bullshit. Like, why is there a shortage? I don't get that. I don't get it. You know, hell, we've had a shortage for fucking baby formula for fucking forever, yet some people can get it. I don't understand. That's just again, that's a different topic. But that's kind of the first thing I thought. And then the pharmaceuticals. This is how we ended up going down that rabbit hole.
Yes,
because,
it was.
As we have said on here, again, many times, the insurance companies, pharmaceuticals, they're way too involved in healthcare. And somewhere in our history in the United States, from a policy standpoint, this has been allowed to happen. And nowadays, if you hear people have insurance, most of the time it's tied to their job. I don't know if I know anyone, well, maybe one person I knew back in the day. This is not even recently, because now she's employed. She had to get on the ACA. But everyone I know, they have insurance through their jobs. And it's basically like, you know, until, you know, we really got ACA, which is, again, just like a Band-Aid, like we always say. Most people couldn't get insurance if you do not have a job. You're either going to pay out the wazoo every month to have maybe even just some basic ass insurance. Let's not even get started with some of the top-notch insurance companies where, you know, it might be close to $1,000, maybe more a month. I don't know, because I'm one of those people. I get insurance through my company, and you know, just again, we continue looking like, how did this get started? Like, how did insurance and medical coverage and care get tied to work? And I said, I think you had stumbled upon, it was like something from like the 1920s, right? Like some miners and people working in the forest, and the company wanted to make sure that their employees had medical coverage. Something like that, right?
Let me pull it up, because I kept it open. So it was during like the early 1900s. So we're looking at like the Industrial Revolution, where obviously these are manufacturing jobs, and there was a lot of workplace injuries. So like unions were growing stronger, and there was this whole thing of like, okay, we need to start offering like sickness protection. So it wasn't like healthcare insurance, but it was like sickness protection. But during that time, there was a bill that was being proposed, and it was the American Association of Labor legislation. So it was legislation being proposed, which basically would have been like almost like a precursor or sort of like universal health care kind of thing. So it would be like, they were saying it's like compulsory insurance would be provided through the government. What was interesting was that the AMA is the American Medical Association, was supporting the initial bill. But then like doctors were being concerned about how they would be compensated, because, you would have this universal health care, which is what I mentioned earlier. I was getting heated because I was like, it sounds like the exact same thing that we're hearing today, about it, of universal health care. So then the AMA was like, oh no, we're no longer supporting this because it's just too much issues. And it so became that there were so much opposition that eventually it just was like, no, it's cutting, like, I think like businesses, like insurance, like private insurance at the time was like, no, it's going to put us out of business. Sounds same thing as today. Or was going to cut into their profits. Similar thing as today. So the legislation just, was done for. And I think there was like, I think I remember mentioning to you, there was a progressive party that was at that time also championing like a national health service or like public health care for like, I think like unemployed and the elderly. And again, like the AMA and other organizations were like opposed to that too. So like, I was like, why does this sound like it's happening today? Like, I swear, it's just what's happening.
Just 100 years or later.
So then eventually, like, the Progressive Party was like done for, and then these legislations just kind of went away. Even like the working class of the time was like not really supportive of like having like this, health care. And it's like, oh my gosh. But they were like saying like, if the US had gone through this and pushed it and really kind of pushed for this public support and like done everything they had to do, we probably would have gotten that universal healthcare that a lot of other European nations at the time were also like on their way to getting, and then sort of starting. So it's just like, to me, fascinating to see and hear a lot of the same issues and like conversations that were happening back then. This is like 1916, like where this happened to, and compared to today, it's a lot of the same thing, and a lot of the same players making the same sort of arguments as to why we shouldn't have it. Cut into profits. It's what about doctors being compensated? What about all these like different things? And that's why we said science versus capitalism, because it's the same conversation. But it really kind of goes to show like, whoa, like we could have had universal health care, but the same sort of players and same type of individuals that were opposed it then are still opposed to it now. And then there's a whole other timeline of like, just things kind of progressing. And I think we got into like the employer sponsored healthcare was happening like during World War II, is where it's sort of the idea and all of that kind of started, into having more like employers providing healthcare to their employees.
Well, and it also reminds me that the working class put their foot in their mouth again,
as we typically do.
When we think, when I think about some people who are part of the conservative party, or just regular po folk, and honey, they're gonna stand on that hill, they're gonna die on that hill. And these people in this party who have the control of this party, who dominate, they don't give two shits. I mean, honestly, I think most politicians are like that in general, but I'm specifically talking about conservatives in this instance. They don't care. And it's just like, it's so fascinating to me when I see people who just kind of stand up for these things that I'm like, you're really just hurting yourself. You're just hurting yourself. You can think about, you'd rather be on the street, child not have anything. But I guess you gonna stand in this ideology. I can't explain. I really can't. Like I can understand people, sometimes things can be hard to accept, but not at the detriment of me and my family. That's just not happening. I'm gonna just have to, bite the bullet and just move on.
Yeah.
But the overall, yes, the thing in this is that we went down this rabbit hole because we wanted to know, like, how did we get into this, like, insurance being attached to, or health insurance being attached to a job, and kind of where it all started. And it's really quite fascinating because, like you said, if Americans just would have pushed this, I can never say the word
legislation.
I can't say it.
Bill. That bill.
They would push that bill through. We might have been somewhat just like countries in Europe or even our neighbor Canada.
Yeah. We would have been on that. We would have been on that path.
We would have been on that path. Yeah.
It would have been like whatever would benefit obviously the United States of America and like whatever, but we would have been, and we would not be having the same conversation we are today. And again, when we were reading and sort of sharing who the players were, those that were opposing, those that were for, very similar to today. I was
like, the same damn players.
It could be like the Republican Party over here. You got the Democrats who are very, moderate. Then you have the progressives out here who are like, hey, we got to do an overhaul of it all.
We need to do an overhaul. That's also another video for discussion of fucking overhaul of the American politics in general. Because this two-party system is obviously not working. Again, that's a topic for another day. But it really is, because it's just thinking about, you also mentioned the AMA. And now, if anyone is in healthcare or, following, the AMA now, obviously they've been around for quite some time. And obviously, they have a whole different campaign now. It's all about equity and social determinants of health. And, a leopard can change their spots. However, like most associations that are for profit, they only gonna push so far. They only gonna say so much. Because when it starts messing with the money, we gotta be careful. Yeah. We don't want to make, or we don't want to lose these hundreds of thousands of dollars, $1 million a year. We gotta be careful. So I do think that's an interesting thing with, and yeah, we're talking about the AMA. It's not just them. There are other organizations as well who are, they're similarly trying to make things.
No, it's not.
Yes, but it's so amazing that like they know just how far to go. They're not gonna go too far, because like if they gotta lose money, they ain't doing it. They just not gonna do it. And again, it goes back to healthcare being a business. But at the same time, I'm like, to the detriment of so many people. I think that's the thing. And, you and I have talked about this because we care so much.
Yeah.
That's why, we got into public health and healthcare. And, different people get into healthcare for various reasons. There are a lot of different careers and different paths in healthcare. But, particularly, I always think if you're going to be in this industry, you need to care. And it's so unfortunate that so many people don't. And like I said, I'm not trying to stop anybody from having a decent living. Because again, we live in a capitalist world. You got to be able to pay your bills. You want to put your kids through school. I get that. But at what cost to everyone else, even yourself? Because, in many ways, Americans are just so damn oppressed. We continue to oppress each other day in and day out. We just continue to do it. And, to me, it's always like this push or pull either way, because yes, people need to have a living, but look at all that it's costing for people. If you can just say what needs to be said and do what needs to be done, because we always say on this podcast is that these systems are working exactly how they're supposed to. Obviously, the people who are benefiting from them are doing very well, and everyone else can go to hell. That's just it.
And you said so much in that. in the time, but I think, kind of bringing it, kind of full circle, or sort of connecting it back to where we kind of started.
Yeah.
The way the conversation around obesity, right, and the way that that this sort of medication has been put into the forefront, because this medication isn't new, right? Like, it's not new.
Yeah.
It's been around. Um, but it wasn't until were more people were using it, more people are putting their stories out there. And people who have lost, amounts of weight, like talking about like 50-60 pounds in a couple months,
Mm-hmm.
and there's and sort of saying like how great they're feeling, and how, how their numbers have improved, how their A1Cs have gone from like double digits to single digits, and like, their cholesterol numbers have, just improved like immensely, and like their blood pressure is a normal, like they've never had normal blood pressures, and now they're like, dude, like 120 over 80, like, perfect blood pressure, like. And it wasn't until because, and I think it goes back to what you said, like the way our society, and apparently especially our United States, like our American thinking, in the way like you should suffer and have to work hard to get something. And it's like, because nobody bats an eye when someone goes to get gastric bypass surgery, right? Nobody says like, oh, don't do, no, we're like, if you need it, you should get that. But the complications of having a surgery, the complications that come from just the infections you can get from a surgery, the complications post surgery, like all these things, like they really would rather you suffer and go through that, because nobody's like, oh, you should, no, that you shouldn't do that, like that's like, no, people are like, oh, but because you're suffering, right, you're suffering, and you're gonna have to like work for it, and you're gonna have to suffer for a good amount of time, and you're gonna be like all these
It's
things.
reactionary.
That's better. That's better than you taking this medication, because it makes it seem like it's easier. Like, it's not easier. Like, it's not like you're suddenly like, it's just like you're just sitting here and the fat's just like going away. Like, that's not the way it works.
Well, in this
Like,
country,
you
we
still
hate fat people. This country hates fat people. They
Yeah.
do. They're, that's, I think, kind of the main thing here. Again, what the hell does it have to do with other people?
It just goes back to like what you mentioned, like there is this mentality in this country of fat people. We talked about it. If you go back to like our plus size series, and if you, even during our dating while fat series that we did, we talk about like this hatred that exists for fat people. This sort of like desire to like shame us, to make us feel less than, and sort of like, fat is ugly. And it's like, no, your attitude is ugly, like your thought process is ugly. Like, it isn't, because we all have a journey. Like for me, like, we've talked about this before, you and I, like always being the bigger girl, always being, the fat friend in the circle of friends, not being able to, really kind of go shopping like normally would, like I would avoid those social kind of interactions. Like I hated going shopping with skinny friends. I was like, I try to avoid them. That's why I was never that friend. I was like, I don't know if I'm introverted, or if it was just I made myself introverted because
or you have to go with like, you got to look at the accessories or look at the shoes. Well, hell, not even shoes, because we talked about shoes are really on design for cute shoes. They never work. Cute shoes are for, narrow feet people. But it's that thing, like you always got to go like, I'm gonna just look at the hats, girl, or I'm gonna look at the jewelry.
Let me go look at purses.
We're gonna look at purses. And I think this is what we want to talk about, capitalism, and this is tangent as motherfucker. I think this is why I love handbags. I love handbags. Yeah. I love handbags because handbags always fit. Always fit. At least the kind I like. Always fit. Yeah, everybody.
I love me a crossbody.
You do love your crossbodies. Yes, you do.
And I don't know if I love it because it's a crossbody or because it hides my little belly.
That's okay.
I don't know.
That's
I don't know. I put it right here, hide my little belly.
Right, and you feel safe. You feel very safe and secure. Yes.
Sure. Like I can hold it right here. I don't know. Like
I think that is my addiction. Yes, go ahead.
But the thing of like the trauma that the hate of fat people has caused for fat people in this country, like somebody should be paying my bill to go to therapy because this country has messed a lot of us up.
So many
the government should be offering us free therapy. Just go out here, get yourself
talk about reparations
on us. Because this country has messed us all up in so many different ways. I mean, if y'all have been following us, y'all know we talk about racism, white supremacy, patriarchy, all these things, all these systems that are still in place. Like I remember once in that plus size series, we talked about how the hate and sort of the disgust and everything with fat bodies, it's rooted in racism, right? Like it's rooted in that, and just sort of this idea and this thing of like, particularly women of color, the backlash about being a fat woman and what it dictates, it'd be interesting to even have like perspectives of like white women who are overweight versus women of color who are overweight, and just the experiences that we go through could differ. It could differ because I know it differs, but it'd be interesting to see like where they overlap and where they differ, because it's like, again, we go back to these conversations about obesity in America and how obesity is not seen as a disease. I was telling you about this off camera. I was telling Martina that I was watching a TikTok from a doctor, a weight loss doctor, who was saying that the AMA, the American Medical Association, designated obesity as a disease in 2013. Yet, a lot of medical professionals, especially insurance companies, still consider and see obesity as a behavioral problem and not a medical one. And this is why, part of it is why these medications have to be tied to a disease in order for insurance companies to cover it. And it's like, and if they are specifically for weight loss, it is harder for you to get. You have to get a prior authorization. You have to have like tried maybe other things. Like there's all these sort of like barriers to getting it. And the people who benefit the most from it aren't able to get it, like aren't able to, afford it, because even when you think about the cost of it, like it's not like you're getting it for like $10 with insurance. Like some people are paying, $50. Some people have to pay like $100 copay for it. Like there's, some people are lucky enough not to pay anything for it. Like bless you and your employer for having really great insurance on that end. If you're like, but it's like, man, like how hard do we have to make it to get healthy in this country? I mean, we've talked about access to food, in this country. You can have access to food in your neighborhood, but it's not food that's going to be good for you.
Exactly. And that nobody wants to do. Like, I shouldn't say nobody. There are people who do want to do things about it, but where it would matter, the people who could help where it would matter, they don't. They just continue to let exactly. It's like falls on deaf ears. It's just like, this could make a difference. Like if they had more grocery stores here, if there were regulations to say, yeah, we need we need stores in this neighborhood. Like there are times when the government can be too involved, and there are times when the government needs to be involved. And I think oftentimes they're just not involved in the ways that they should be, and they're overly involved in other ways that they shouldn't be. And I just think this is an instance where we could definitely have with more regulations and say, like, you know, if this is a food desert, if this is a food insecure area, why is like nobody should live in an area like that. That should not be an issue where people can't get fresh produce. They couldn't, you know, get more fresh food, healthier food. That should never be an issue. I mean, food shouldn't be an issue anyway. And it's just, you know, again, it's just sad. It's sad. And, you know, again, there are people that'll fight you tooth and nail about that, make up every excuse in the book as to why this shouldn't happen. And to me, that is so sad. That is so sad. That is so sad. You don't want people to have adequate food. It's so sad to me. I can't wrap my head.
Especially a country that's going to, you know, vilify obesity, right? And then be like, oh, terrible, evil, bad, ugly, whatever, all the things that they use to describe fatness in America. But you won't do anything to ensure people actually have access to the things that would help them, that would help them make, you know, whether the healthier choices or just be able to move more, be able to just eat fresher food, because sometimes they may be groceries in our communities, but they be having some terrible options for veggies and fresh fruits that I don't know if I'm frozen.
I think you had
froze.
You froze. Well, I didn't freeze for me, but you froze. But now you're back.
Okay, you were frozen for me, so okay. I don't know. But hopefully this recorded. You know, if y'all been following, y'all know we don't be editing out any of our little.
We don't edit out much. So y'all just gonna see it as it is. You know,
y'all just
you know what we're trying to say. You know what we're saying. Okay.
You know, we'll about this roll with it here.
Yeah, just roll. Okay, y'all know.
But you know, like, how are you gonna vilify obesity, and how are you, you know, really gonna say like this is something that needs to be, you know, you need to do something about it, you need to change, you need to, and then not actually do something about the access to food, you know, the walkability of a community, you know, how safe a community might be, like all these different things that kind of contribute to what we should be quote unquote doing to lose weight. And you're not gonna help. And then there's medical, and you're also gonna put barriers, and you're gonna make people feel terrible for taking it or, you know, using it because it's helping them. Like, you can't have it both ways. You can't have us want to be healthy and like you want us to lose weight, and then when there's something that's actually helping, but because it's not doing it in a way that you think fat people should lose weight, then you're gonna be like, no, you know what? I don't know if you saw it. They were like, you're gonna get this Ozempic face. I was like, Ozempic? It was the dumbest thing. I'm sorry, it was the dumbest thing I heard, because all it was is, you know, when you lose weight, your face is gonna slim down.
Yeah, your face slims down, right?
Your face slims down. It might sag a little bit because, you know, you're gonna have loose skin. You're losing weight. You know, if you're not taking collagen supplement, if you're not doing all these things that you could help you to keep it plump and everything, it's gonna happen. Like anybody that loses, you know, a lot of weight.
Yeah, one time, yes.
You're gonna look like, they're like, oh, you're gonna get this skeleton face. It's not skeleton face. It's just what happens when you lose weight.
Well, you know what?
To do with the medication.
But you know what? The skeleton, now, okay. They want to talk about a skeleton face. Yeah, we got models on the runway who don't even weigh 100 pounds. But it's okay for them to look like a skeleton. But somebody who's trying to improve their health, they can't look like a skeleton. Now, I'm not saying right versus wrong, but I'm just saying, think about this. People need to think about that.
It's the conversation.
These are the conversations that people need to be having. Like, think about what that person just said. Think, like, really. We got models who not even 100 pounds soaking wet. But that's okay. That's okay.
But nobody's saying anything. Nobody's being like, oh,
yeah.
Well, let's not, you know, demonize them. But again, it was like, I read that and I was like, you have got to be kidding me. I'm telling you, these industries, especially industries that are based on people being fat and sick, are saying some of the most outrageous things about this medication. Because what is it? It's cutting into their profits.
The money.
You know, imagine if everybody that was obese took this medication, lost the weight, got healthy, stayed on a health journey for the rest of their lives. Nobody's going to the doctor to prevent anything because they're like, hey, I've been preventing, I'm good, my numbers are good, everything is fine. Like, you know, you might not have all these things. You're no longer buying, you know, the slim fasts. You're no longer getting like your teas that are going to slim your stomach. Like all these things that are part of our capitalistic society for fat people, they're no longer buying it because there's this medication that they're able to take. To me, it screams capitalism. It just screams sort of like we don't want to lose our profits. We don't want to like, because a lot of these like fitness gurus and health gurus that are out here, you know, sort of demonizing this medication and these medication options that exist for obese people. I'm like, are you afraid you're going to lose money? It's like, is that what's going on here? Because that's what it sounds like to me.
That's it.
To someone who's taking this medication, who has benefited from it, whose numbers in a month improved. Like in 1 month, my numbers went. Well, I was one of those that went from double digits to like a single. I was like, my doctor was like,
I remember you saying your doctor was like, oh my,
this doesn't happen. And she's like,
right, it doesn't happen.
She's like, this isn't like people go a long time with like, and I was like, she's like, were you just taking the injection? I was like, that's it. Because she was like, I misunderstood. I was supposed to continue taking my other medication while still taking, so I misunderstood. But I was like, but I was feeling so much better in just a month of taking. It's like I started sleeping better, like all these things. And my doctor was like, you know what? It's working for you. We're going to continue and, you know, and see you back in 3 months and we'll reevaluate and see where you're at. But I was like, but to see that improvement and then to hear other people have very similar journeys and then to hear all these other people coming out and being like, oh no, like this is bad for you, like, oh my gosh, you wait and see, you're gonna be one of those like people are gonna have like a lawsuit, you know, because I was like, look, I'm preventing diseases over here. I was like, I'm being able to control what I eat. I've been able to eat healthier, make better decisions, which, you know,
because you're not as hungry. Even I'm like, you just like whatever the medications are doing, like you're really not as hungry. Like, you know, you probably have to eat smaller things throughout the day because really a big meal is just not happening. Like that's just very few and far between. I know for me, you just can't eat a lot at one time.
Nope. And then when I do eat, because I don't have these like, I don't even know how to describe it, like hunger pangs or whatever it could be, like I make better choices because I'm no longer, you know, coming from a mentality. I don't know where I was, you know, 3 months ago before I started 4 months ago, where I was like, I don't know how I was making decisions in food because it's definitely not the same decisions I was making today. I was like, and it's definitely like, again, if you
you froze on me again.
Never been an obese person.
You froze like a popsicle. Okay, you coming back.
So look, I got the dreaded my internet connection's unstable.
You came back. What? You back now? Oh shit! I spoke too soon. You were frozen a cute way though. You were looking like so precious.
Am I back?
Yes,
back?
You're back. Yes. Finish your statement.
You know, like I don't even know what I was saying. I'm done.
Well, you know, I think, you know, I think we've come to a probably good point. And you know, to probably wrap this up. But it's just, again, you know, we're going to continue talking about this, and you know, I'll close with, Lord, I hope this doesn't open up the can of worms. But you know, one thing people have so much to say about this is because this is happening to people that are deemed undesirable and that you shouldn't care about. Yeah. Just like with food insecurity, you know, just, you know, like drug abuse, whatever. It happens to people that society here in the United States have deemed we shouldn't care about them anyway. So we can say and talk about them all that we like. But however, when it happens to white people, it's a whole different thing. And an example is like we've had for years. We have this whole opioid addiction. It's been a thing for years. It has been nothing new within the Black and brown communities. It has, drug addictions. It's, has been happening. I mean, shoot, we can go back to the crack epidemic in the 80s. But it's not until these things start affecting people that it's not supposed to affect, then it's a whole thing. Like when we start seeing housewives in like the suburbs being impacted by opioids, oh God, we gotta have like a whole public health emergency. Yeah. This is such a big thing. Like, what are we gonna do? Yet other people have been dying for years and nobody gave a shit. But that's all I'm saying. Until next time. Yeah.
Yeah, no, I think just to kind of close out and give final thoughts, I think I agree with you. I think and the crazy part, and we can get into this later, is the people that I've seen taking the medication is definitely more white individuals.
Yes.
Than women of color, men of color, just people of color, which is a whole other episode to kind of unpack there, because it's been very interesting. I haven't seen a lot of people of color pop up on my feeds that are talking and sharing about their journeys. But yeah, I think it's sad that we continue to have these just attitudes towards obese individuals, to sort of continue to shame them, to make us feel less than, to make us feel less than, right? Because it's me that people are talking about, and in us, to try to make us feel like we're not worth anything, that we're not worth being able to make medical decisions and then sort of do what's best for us, and that there's medication out here that's helpful. And you have so many barriers. You have doctors who aren't willing to prescribe this to people who are like, hey, I see this happening, is helping people, like, can we talk about it? And they're like, oh no, like, that's not for you, like that's not, we can't have that conversation. Insurance companies are like, no, you can't have this medication because it's you should try these other ones first before you can get this, and there's these whole barriers to getting it, and then or insurance companies just not covering, and then you're dependent on a savings card of a company like I am, but that savings card is going to expire at some point, so what do you do? So I think there's so much more to unpack. I think there's so much more conversation. So this is the first episode of a couple more where Martina and I will continue sharing our thoughts and our experiences, not just with the medication, but just really digging into insurance, and just the healthcare, and continue to talk about healthcare in America, racism within all of these structures, and the role that plays into who has access to the medication and who doesn't. So I think we're definitely going to come back. This probably will be a couple episodes that we'll do, and be back with more to share and more to talk about, and yeah, it's gonna be, I think this is gonna be a very interesting sort of series for us both. Yeah. But
I'm interested if anybody have comments too. I'm interested in hearing, is anybody else on this journey, or know someone, or just have any insight you are willing to share, please do.
Yeah, you can comment. If you're on YouTube, you can comment, you can reach out to us. Our contact information is around. You can find us on Instagram or Facebook and reach out to us there. But we'd love to hear, especially if you are taking one of the medications that are out there. I know, like, the big ones that you hear about is like Ozempic and like Wegovy and like Mounjaro, and there's other ones that you can take. So definitely interested to kind of hear people's experiences. And if you disagree with us, go ahead, let us know why. We would like to hear, and as we always ask, be respectful and kind with your comments. And and then we'll kind of have, some discussion around that. But thank you for watching, listening to us as we're coming back from our hiatus we've been on, and we look forward to just continuing this conversation, and we look forward to either talking to you and in the next couple episodes. So join us next week and to continue this conversation.
Take care, everyone.
Bye.